Good day everyone, I am Princess May Madalo from BS1A. So today I will demonstrating a charting. So first let's define what is charting. So charting is a process of preparing a complete record of a patient's care. An accurate, detailed charting shows the extent and quality of the care the nurse have provided, the outcome of that care and quality of the treatment and education that the patient still needs. Charting is a day-to-day, event-by-event documentation of a patient's care and condition by a registered nurse. And it is also a vital tool for communication among healthcare team members. Commonly, decisions, actions, and revisions related to patient's care are based on charting from various team members. Well-prepared medical record shows the high degree of collaboration among healthcare team members. So the nurse's notes is a medical note made by a nurse that can provide an accurate reflection of a nursing assessment, changes in patient's condition, care provided, and relevant information to support the clinical team to deliver excellent care. So the rule of charting accurate nursing documentation is important for many reasons. So the first is it's a mode of communication among healthcare professionals. Then the second is it's check and healthcare evaluations. The third is it can be used as legal evidence. The fourth is used to aid research and education. The fifth, it helps facilitates to obtain accreditation and licensure. The sixth is used to justify reimbursement request. The seventh is it's used to develop improvements in the quality of care. The eighth is indicates compliance with the State Nurse Practice Act, and lastly, it establishes professional accountability. So the type of documentation system is narrative charting and the SOAP note. Okay, so the narrative charting allows a basic to a very detailed description of the assessment, care provided, and planned, and the patient's response to the treatment and teaching. So the SOAP note, the term SOAP is actually an abbreviation of the parts of the note. These are subjective, objective, assessment, and plan interventions. So the subjectives refers to things the patient can tell you and often includes pain level and feelings of concern. Can also refer to things a patient's family members tell you. So the objective refers to hard data you collect regarding the patient. This can include vital signs, laboratory results, observable signs and symptoms, and your physical assessment findings. So the assessment refers to your overall interpretation of the subjective and assessment. Is the patient improved since admission? Are there new issues that you are observing that need to be addressed? All of these things belong in the assessment. So the plan refers to the patient's plan of care. So how is the medical team addressing the patient's health problems? Are there upcoming tests or blood draws? Is the patient on medication to treat a problem that you are monitoring a response to? Then these are examples that fall under the plan. So the intervention refer to the things we are doing for the patient. So examples of intervention can include treatments and medication as well as education provided to the patient on your shift. So the purpose of this charting is that provides a means of communication among healthcare providers and a legal record of patient care, and used for education and research and for the nursing audit, the evaluation of the quality of nursing care, and then to reflect the standards of within an institution. So the materials or equipment that we are going to use are paper and pen, jot down notebook, and nurse's notes form.
For the assessment, assess the patient. For the planning, prepare the materials or equipment. For the implementation, document exactly what you observe, hear, inspect, do, or teach. Document how your patient responds to care, treatment, medication, and his progress toward the desired outcome. Include notification to the physicians for changes that have occurred. Document the physician's response, new orders that are followed, and the patient's response. Organize your notes by using head-to-toe approach or by referring to the care plan and documenting the patient's progress in relation to the plan and any unresolved problems. Organize your narrative note. Be specific and document chronologically, recording the exact time. For the evaluation, inspect completeness of the notes. For the documentation, record significant time when notes were completely done.